Town Hall. My name is Zach Rodvold. I'm the State Director for Senator Klobuchar, and I'm going to be your moderator for tonight's Town Hall meeting. In a moment, Senator Klobuchar will start us off with some opening remarks, but first I want to explain the format for tonight's call. Joining Senator Klobuchar tonight are Dr. Denis Cortese, the CEO of the Mayo Clinic, and Mary Wakefield, the highest-ranking nurse in the federal government. After the Senator and our guests have made brief remarks, we will open it up for questions, and we'll take as many as time allows. If you want to ask a question this evening of the Senator or her guests, please press *3 on your phone, and a member of our staff will assist you. There are thousands of people on the call from around the state tonight, so please keep your questions as brief as possible so that more people have an opportunity to participate. And if you're unable to ask a question during tonight's forum, you'll be automatically transferred at the end of the call, and we encourage you to leave your question or comment at that time. Remember, if you'd like to ask a question, please press *3 on your telephone keypad. If you're able to get to your question, your name will be called and you'll be asked to repeat your question for Senator Klobuchar. With that, I'd like to introduce Senator Amy Klobuchar.
Thank you so much, Zach, and thank you so much for joining us, everyone, on this call tonight. I know you're all busy, and I especially appreciate you taking the time to speak to me this evening. I'm so sorry about this delay. Part of it was we have such overwhelming interest in this call that the technology couldn't quite keep up, and I think we're up with it now, but we have thousands of people from all over the state joining. I also want to thank my guests, Denis Cortese and Mary Wakefield. Dr. Cortese and I have worked together on many health care issues, and as Zach mentioned, Mary Wakefield is the highest-ranking nurse in the federal government, and I know they're standing ready to answer your questions as well. Health care reform is a very personal matter for me and for my family. When my daughter was born, she was very sick, but due to an insurance company rule, I was forced to leave the hospital just 24 hours after she was born while she was still in intensive care. And along with other mothers, I went to the state legislature, and we got one of the first laws passed in the country guaranteeing new moms and their babies a 48-hour hospital stay. That experience was a crucial part of my decision to enter public service and fight for common-sense health care solutions. I also know that health care is a very important matter to all of you. We've received over 18,000 letters from Minnesotans and emails talking about the importance of enacting affordable health care reform that brings down costs and improves the quality of care. And we have heard this all over the state, people like Dawn in Staples who's struggling to afford the prescription drugs necessary to treat her multiple sclerosis, a woman named Joan in Wilmer who told me about how she was denied insurance for a pre-existing condition and how she now struggles to afford any visit to the doctor's office. Meanwhile, a recent study by the Council of Economic Advisors found that small businesses pay up to 18% more than large businesses to provide health insurance for their employees, and it often forces those businesses, small businesses, the backbone of our business in Minnesota, to lay off employees or cut back on their coverage. So I've been hearing a lot from small businesses over the past month about how they want a sensible, workable solution. In my travels around the state, and I know this can be a contentious issue, and I'm hoping on this call today we can at least agree on some basic values that we all have when it comes to health care that I hope will be included in a final bill. And as you know, there is not yet a final bill in the Senate, so that's one of the things we're doing this month is getting ideas from people all over the state for what should be in that bill. The values I've found in common with all Minnesotans is, first, we need to build on what works in our state. The President has continued to use the Mayo Clinic in Minnesota as a model of high-quality, efficient care. Minnesota has a strong history of making sure that our health care system promotes both quality care and access. Second, we need to reduce costs and make health care more affordable. The cost of premiums for family health insurance has doubled in less than 10 years, and we know that it's projected to double again in the next 10 years. These are premiums for people in our state. And also Medicare is slated to go in the red in about 10 years. So we have to find ways to rein in costs, and we know we have these examples right in Minnesota. Last, we need to make coverage stable. This means implementing safeguards so that people don't lose their coverage if they lose or change jobs or if their kid goes to college, and make sure that the costs are stable so that they don't threaten our families' finances. I know this is a complex issue, and the process in Congress is complicated, and that's why this is an opportunity to listen and to talk to experts on this and to get some shared knowledge so we can all go forward in this debate. With us tonight, as I mentioned, the CEO of the Mayo Clinic, Dr. Cortese, and also Mary Wakefield, highest-ranking nurse within the federal government. With that, I'm going to turn it over to Dr. Cortese so he can make some brief opening remarks, and he'll be followed by Mary Wakefield, and then we will take your questions and comments.
Senator Klobuchar, thank you. This is Denis Cortese, and the Senator asked me to address, I'm going to mention just 2 points that have arisen through discussions from the Mayo Clinic Health Policy Center that has engaged over 2,000 people and who represent areas of the health industry, and another 1,400 people who spoke as individual patients. And we've been doing this work for the last 3.5 years. 2 major points about health care in the United States. First, strongly in favor of the concept of health care reform, and we're strongly in favor of the concept of insurance reform. Those are 2 separate concepts. Health reform, health care reform, really gets to the heart of how to reduce the rate of rise in the growth and the cost that we all have to spend. It really is true healthcare reform is payment reform, the way we pay for our services so that we're paying for better outcomes, better safety, better service at lower costs over time. Now, in our Health Policy Center, we call that value, outcomes, safety, and service, divided by the amount that we spend to get those services. And we've recommended that Medicare focus on beginning to pay for value. It does not pay for value now. It does not pay for outcomes. It pays for whatever services a person is ordered to have or requested to have. There's wide variability, and there's a lot of cost there. So we are strongly urging that the country focus on payment reform as true health care reform, and that we start with Medicare, which, after all, is the largest government-run public plan in the country. It's the one that's bankrupting the country. It insures over 45 million people, and that will be growing tremendously in the next few years. So that's number 1. Healthcare reform, in our mind, is paying for value. Number 2 is insurance reform. Now, insurance reform is what many people are talking about currently. We agree you need insurance reform also. So we recommend both of these reforms. Healthcare reform, paying for value, and insurance reform. And what we mean by insurance reform that has arisen through the Health Policy Center are these items. Number 1, everybody should be insured. Number 2, there should be a mandate that individuals should own their own insurance. People should have choice in what insurance they'd like to buy. It should be portable, that there should be no pre-existing conditions or exemptions, that the employer can buy the product if they would like, but the person should own it. The individual should own it so they can change jobs without losing coverage. And there's a significant role for government, and that is to provide a sliding scale subsidy so that people can purchase this. There's been a lot of discussion about exchanges, and our recommendation through the Mayo Health Policy Center is to use the insurance product, the public plan that all of the employees of the federal government have right now, the Federal Employees Health Care Plan. So I'll leave it at that, Senator, and turn it back to you.
Okay, thank you. Thank you very much, Dr. Cortese. And now we're going to hear from Mary Wakefield.
Thank you, Senator Klobuchar. Well, let me comment on just a couple of the healthcare challenges that we face, both in Minnesota and across the nation. One of the most serious concerns is, of course, the affordability of health care coverage. In fact, with every year that goes by, people with health insurance are paying more and more out-of-pocket for insurance coverage. Nationwide, out-of-pocket costs for health care coverage have jumped by 32% in 5 years. These rising costs affect individuals, families, and businesses. In Minnesota, between 2000 and 2006, the percent of small employers in your state that offered health coverage benefits to their employees dropped, and it dropped by about 6%. So we're seeing an erosion of these critically important sources of coverage. Recognizing this challenge, health reform efforts are needed to strengthen the ability of small businesses to continue to provide insurance to their employees. And the high cost of health care isn't just impacting businesses and families, it's also hurting health care providers and our economy. In terms of healthcare providers, hospitals and doctors' offices and others in Minnesota lost over $1.2 billion in bad debt. They can absorb some of this financial burden, but they certainly cannot absorb all of it. So what happens? Well, it gets passed on to everyone paying for insurance in the form of higher premiums, really a hidden premium tax, if you will. Minnesota families and businesses shoulder a cost of about $400 per year as a direct result of subsidizing the costs of the uninsured. In addition to addressing the rising costs of insurance facing families and businesses, health insurance reform will expand coverage to keep people healthy. For example, in Minnesota, about 20% of women over the age of 50 have not received a mammogram in the past 2 years. So let's say you're walking down the street of pretty much any town in the state. Basically, 1 out of 5 women in that age category, that is age 50 or older, that you pass by, will not have had this incredibly important screening. A screening that, as a nurse, I know can save lives. So redirecting the emphasis to include a stronger focus on preventing illness is a priority, as well as ensuring affordability of health care coverage. With that, thank you again, Senator, for the opportunity to join you and your fellow Minnesotans in the discussion this evening.
Thank you, Dr. Wakefield. We are now going to go to the phones here for some questions for the Senator and her guests. The first question will be from Margaret in Coon Rapids, who had a question about quality of care. Margaret, go ahead.
Okay, I heard there will be 50 million more people covered under the new Obama plan, and there will not be enough doctors to take care of all these people, and therefore health care will be rationed, and it will start with the elderly by having their Medicare cut. Is this true?
Well, thank you very much for that question, and I've heard a lot of talk about that rationing. I want to tell you, as someone whose mom and dad are both on Medicare, I'm not going to be rationing health care. And first of all, let me tell you that we don't have a set plan yet out of the Senate, as I mentioned, and a lot of people refer to an Obama plan or a House plan, and we are still working on our plan in the Senate. And one of the things that I know that we will protect is Medicare. It really has been one of the best programs ever. When it passed, one interesting fact, we're on its 44th anniversary, it was actually a close vote because people weren't ready for that change. Now we realize it's so important for our seniors. And this idea of rationing, I think it comes from some discussion, which Dr. Cortese, and I'll let him answer after me on this one, but this discussion of how we have to control costs. Here's one interesting fact that everyone needs to know. Most of the places that have high quality actually have lower costs, and the Mayo Clinic's the best example of that. Last 4 years of chronically ill patients' lives, this was an independent study out of Dartmouth, and it showed that if all the hospitals use the same protocol that the Mayo Clinic uses, where you really make sure that the people have a primary doctor and a team working with them, the quality rankings are incredibly high from the families. Those cases, if we did that all over the country, we would save $50 billion every 5 years in taxpayer Medicare money, $50 billion. So my point is this. If we can get that kind of integrated model and put incentives in place, we actually save money and have much higher quality care. This isn't about rationing. It's actually about getting higher quality care like we have in Minnesota instead of having all of our money go down, taxpayer money, to other states that are being less efficient. And maybe Dr. Cortese wants to add to that.
Yes, that's an excellent question, and it gets to the heart of what we mean by value, getting the best outcomes, the best safety, the best service. It turns out that the places in the country that are getting the best outcomes, the best safety, and the best service are actually doing it at much lower expenditures, total expenditures, particularly in the Medicare program where we have solid information since 1983 that has been tracked every single year. For instance, in Miami, the cost for a Medicare-aged patient is about $16,000 per year, and the outcomes are mediocre at best. In Hawaii, the costs are $5,500, and they have among the best outcomes, the best safety, and the best service in the country. So there's a wide variation, and if we can begin to focus on making sure that the providers who are giving the best care to patients are the ones who are fostered, who are supported to make sure that they are functioning well, then what Amy Klobuchar was mentioning will come true. We will save money, and that will significantly reduce the need for any type of rationing or making the country go broke having to contribute significant dollars in the future.
Thank you, Dr. Cortese. The next question, we're actually going to take a question that was emailed to the senator from the web from Diane in Montevideo, who said in her email, only 12% of surveyed people said reforming health care was the most important issue Congress should be working on right now. Why are you, Senator, rushing this bill through Congress and ignoring the concerns of the American people?
Well, I appreciate that question from Diane. I understand why people are concerned that we are careful with this. We want to keep what works and fix what's broken in this country when it comes to health care. And actually, I think the fact that we are taking time on this bill and that we didn't have some artificial deadline back in the summer that was met, I actually advocated for taking longer. This is 17% of our economy. We can't turn it around overnight, and we're going to have to be very careful how we do this. At the same time, I have found it's much higher than 12% of the American people. I don't know where Diane got that poll, but there are many, many more people that know that we can't sustain this in the long term because all of these projections have showed that we've already doubled the premiums. In Minnesota, I think it's been a 90% increase since the year 2000, and then we are going to have another 100% increase in the next 10 years. Medicare, as I mentioned, going in the red in 10 years. And so we cannot continue the way we are, and we want to get higher quality care. So we have these two factors going on. Let's get higher quality care. Let's have more stability so if people lose their jobs. And that's the impetus for change. But at the same time, I think we can get something done. I'm still hopeful. I talked to Senator Snowe from Maine last week about this. They are still working very hard on this. And I don't think people should get about small businesses. They want this because they, as I mentioned, are paying 20% more than large businesses, 20% more than large businesses for their health care. We've got large businesses that are having trouble competing on an international basis against companies in other countries that have this incredible, they don't have some of the middlemen, shall we say, who are shuffling paper in the middle of all this. And we need to change the way we do business, but we've got to do it so that we keep what's good, which is our doctors and choice, where we can pay for reform in a smarter way so we reduce some of the costs of this healthcare spending, and then finally minimize waste, fraud, and abuse in the current medical system. And part of this is the insurance reform that Dr. Cortese referred to, and then the other piece of this, of course, is the trying to do something with payment reform, something we should care a lot about in our state because it helps our state. If we just do across-the-board cuts to Medicare, that doesn't help our state right now because we have some of the most efficient health care in the country. So what we want to do is change the system so it has incentives for that higher quality care.
Thank you, Senator. Just a reminder to all those on the phone that if you'd like to ask a question, just press *3 and you'll be transferred to a member of our staff who can help you. The next question comes from Jim in Winona, who has a question about tort reform. Jim, go ahead. Jim, are you there? Okay, we lost Jim. We're going to go to Laura in Woodbury, who has a question about Medicare reimbursement. Laura, go ahead.
Hi, this is Laura. I just have some ideas about the cost containment issues, payment reform, and I don't hear people ever talking about actually removing the third-party payers so we have a direct relationship between a consumer and provider. I'd just like to mention 4 points I think that this would help. It would even that playing field for prices. You're talking about small businesses versus large businesses. It would even that playing field. I think it would deflate prices because I watch my own medical bills all the time with inflated prices that are chopped down for certain insurance contracts. I think it would make wise consumers when they have a direct reimbursement between their provider, and then I believe it would make better competition between providers. And I have some other thoughts about what you would do to make up for catastrophic coverage and things like that. I'm just wondering your thoughts on that.
Well, thank you very much. And our whole focus here is to try to even the playing field so that people have good insurance, and they have the kind of health care that they need and they want. And as I said, Minnesota, we've got something like 93% of people covered. We've got good health insurance, but our issue really here is that it's getting harder and harder to pay for those insurance premiums. So a lot of the proposals out there are to, first of all, have some kind of insurance reform, as Dr. Cortese mentioned, and that would mean, making sure that pre-existing conditions are allowed, so that someone isn't just got cut off because their kid has autism or something like that. I mean, it's horrendous when you think about it. If you already have a child with a problem and then you're not able to get health care, so that's one reform that would help to even the playing field for families in this country. Another thing is to have some kind of a competitive option out there, whether it is this co-op idea, or which both Dr. Cortese and I support, allowing people to buy into that federal health care plan that 8 million employees are already on, so you can get that kind of leverage that you get with a number of people that are already in the same healthcare system, so they can use the power of numbers to get a better bargain. So those are just some ideas to even the playing field.
Okay. The next question comes from Robert in Rochester, who has a question about the so-called public option. Robert, go ahead.
It's Bob Megerline in Rochester. Hello.
You're on. Go ahead, Robert.
Hello. Senator, thank you for doing this. And my question is, do you support a public option? And if not, why not? And if so, why?
Thank you very much for that question, Robert. And I will tell you this, I am open to some kind of a competitive option. It hasn't really been defined yet in the Senate bill, and I believe you need to put pressure on the insurance companies to get a better deal for consumers. And you can do it many ways. One of them is to have some kind of a competitive option. The one that I would prefer would be one where you allow people to buy into something, either the federal health care plan itself or something exactly like it. 8 million people are on that plan, and they really use the power of numbers to get a better deal. The government does administer it, but it's private plans that you get to choose from, a number of different plans, and then you, because there's so many people on them, you get a better deal. And so that is one way we can do this. Also, we can better regulate insurance companies. I've pointed out a number of those things. If people lose a job, that they get to keep their insurance. If they have a pre-existing condition, those kinds of ideas. And then, of course, we have this co-op proposal that really hasn't been formed yet, but it would call for some kind of membership-based, membership-controlled co-ops to offer health insurance through a health exchange. So those are some ideas. And what I want to do when I look at these is to make sure that whatever option we have out there to put that kind of pressure, to bring that kind of competition, to bring the rates down, works for our state. And I will tell you, I'm especially focused on making sure that any reforms we have make it easier for small businesses and the self-employed to be able to buy into health care. And one of the ways you can do that is with some kind of a competitive option. I don't know if Dr. Cortese or Mary Wakefield want to add to that just from their perspective.
Yeah, I'd be happy to, Senator, if I may, just very briefly. It sort of ties into Laura's question, the one just before, about the issue of direct contracting. The introduction of competition, I think, does make good sense. Whether it's a public option or it very much depends on what we mean by a public option. Many people are for a public option, but at the same time they're against government-run insurance. Most people don't recognize that Medicare is a government-run insurance plan, for instance. So is Medicaid, and there are others. The Federal Employees Health Care model happens to be one that has a fair bit of competition. But this idea of competition with the direct contracting, these models are being tried throughout the country. We have a lot we can learn from them. The Cerner Corporation, working with Intel, has no insurance in the mix. They do direct billing and direct payment to doctors using a card that also contains the electronic medical record. In Seattle, there's several models like this, where they make direct contracts, but not so much to individuals, but to groups of individuals that may be working for certain employers. Health Partners does some of this in the Twin Cities. Group Health Co-op in Puget Sound, as you already alluded to, Senator, has some of these features. Intermountain Clinic in Utah has some of the features that we're talking about, where individuals are much more closely linked in the cost of medical care and making the decisions. And it is of interest, just on the other side, is that Medicare the government program for people who are my age and over. I'm 65. I'll be going on Medicare in about 2 months. Medicare prevents individuals from directly contracting with physicians. So there's an awful lot to learn in the United States, and we can do this by modeling various types of options into whatever package we provide as a series of choices for individuals.
And this is Mary. I would just add that the President has always said that what is essential from his perspective is that health insurance reform must lower costs. It must ensure affordable options for all Americans, and it must increase choice and competition in the health insurance market. He believes that the public option is the way to achieve those goals. He has always said, though, that he is open to other good ideas as well. So just to share that perspective, within the context of a marketplace, a menu of choices, Senator, you mentioned the Federal Employee Benefits Plan. It really is about creating a marketplace or a menu that is fairly easy to compare insurance prices against, to look at the benefits associated with each individual health plan, and then decide. It allows individuals to decide what plan is best for them or for their family or for their business. So that competition is absolutely critical, and consumer choice.
Thank you, Mary. The next question here is from Larry in Mound, who had a question about tort reform. Larry, if you're there, go ahead.
Yes. I've been listening carefully and listening to the senators and congressmen and the president, and I'm not really hearing much about tort reform. And I feel that so much of medicine today is practiced defensively to protect the doctor who's treating the patient from lawsuits. For instance, getting tests that perhaps they wouldn't necessarily need. For instance, if a person sprained an ankle, they may actually wind up with an MRI just to protect the fact that they didn't miss some little crack or something in their leg or whatever. And that's basically it. How are they addressing tort reform in this whole plan?
Thanks very much, Larry, for that question. And I'd like to see some work in this area, and especially like to see a Minnesota-style model brought out nationally. In our state, we have a rule where every time someone files a malpractice lawsuit against a doctor or hospital, they have to secure an affidavit from a qualified expert who says that the suit has merit. And in 2006, a few years ago, Minnesota had the lowest malpractice premiums in the nation. And areas which have efficient care, like Iowa, North Dakota, and Minnesota, tend to have the lowest malpractice premiums. So yes, there are some reforms, but I would also add that if you look at those high-quality states that have systems that really work, that put primary care doctors and people working as a team and good information shared, good medical records sharing like you have at the Mayo Clinic, you tend to have less medical errors, and then you also have less medical malpractice suits as well.
Thank you, Senator. The next call is from John in Hinckley, who had a question about funding for Medicare. John, if you're on, go ahead.
Yes, hi, Senator. I'm on Medicare, and you said that we would save $50 billion on Medicare just by improving the system. But President Obama said he would like to cut $500 billion out of Medicare, and that the system, that our Medicare would be broke in 10 years. And wouldn't that create Medicare to be broke sooner? And what will happen to us on Medicare?
Well, thank you, John. Like my parents, Medicare, I can tell, means a lot to you. And let me tell you, first of all, the figure that I used was $50 billion. That's just based on what Mayo does for the last 4 years of chronically ill patients' lives, where if you ask people around the country, could you have the same kind of treatment that you get at the Mayo Clinic when you're really sick? I think a lot of them would say yes. Well, it turns out if they did get that same kind of treatment, and if they did have a more integrated care model, not only would they get that high-quality care, we'd actually save $50 billion in 4 years. And remember, or 5 years. That is just one set of patients. And so I was actually out at Dartmouth, where they're doing a lot of studies in this area, where they talk to people who have spinal problems, and they say, okay, here are the different surgeries you can have, or you can have no surgery, you can have this kind of treatment, and they actually have them talk to patients, and they have a video of patients, and they let the patients be in the driver's seat and make those decisions. And there are many cases where you can save a huge amount of money, and that's what the President's talking about. And I want to make very clear that the proposed changes for Medicare are not cuts to benefits. That is not what we're talking about. We're simply talking about organizing the system. I'm sure everyone on this call can think of one example where maybe they had an incident or know a relative in another state where things weren't really that organized and efficient when it came to their health care, and that they could have gotten better care and actually less expensive care if it was done in a more organized way. That's what we're talking about.
Again, I just want to remind anybody, if you have a question, just press *3 and we'll get to you as soon as we can. The next question is from Kevin in Duluth, who has a question about cost containment. Kevin, go ahead.
Yeah, my question is, it seems the discussion is primarily concerned with how things are paid for, not as much as why the prices are so high to start with. What steps are we taking to reduce the cost of health care, and specifically the prices of such things? We don't have a lot of competition, it seems to me. One area that I see is competitive right now is LASIK surgery. Is there something like that that's going to come down the pipeline? Thank you.
Dr. Cortese, would you like to respond to that question first?
Well, I think Kevin's exactly right. Competition is the key. I would certainly agree with him. LASIK is a very good example. That happens to be a service that is not covered by insurance. Very rarely is it covered by any insurance company that I'm aware of. And indeed, with immense competition in various cities, the rate of that procedure, which started maybe around $2,000 per eye of surgery, has dropped somewhere in the ballpark of sometimes $500 or less per eye of surgery. And that is something like cosmetic surgery that is elective and not covered by insurance. Now, on the other hand, when you look at transplantation is a service that has grown up on the Internet. All results are published. Every doctor's outcomes are published. All the costs are published. The waiting time for organs and the survival rates for individuals as well as the organs are all available on the web. And that's the kind of vibrancy we need to interject into healthcare, especially for the most expensive services that are provided to people. So I agree with Kevin. This is the kind of thing we're talking about when we mean healthcare reform. That's true reform.
And that was a very good question, and Kevin, thank you for that. And I wanted to add just a few other things that we can do. We want to reduce these readmissions to the hospitals. That's good for everyone. I mean, who wants to go back in the hospital, right? So if you can fix things in the first place, you don't have to go back. And if we reduce those readmissions, we save costs, but we also have better results when people are leaving the hospital. This idea of bundling, which means that doctors and hospitals get paid for the end result and not for how many tests have they ordered, but what do those tests produce? What does the surgery produce? We want to get good results. Having more primary care physicians out there is really important. I know it's something that Mary has worked on a lot in the rural areas, and I certainly have heard this over and over again when I've been out. I was just at Park Rapids Hospital a few weeks ago and saw firsthand, talk to them about how hard it is to keep primary care doctors in the rural areas, and that's a very cost-effective way and something people in rural Minnesota really want to see. I was reminded, Mary and Dr. Cortese, over and over again about how we needed to have special health care in the rural areas on my visits, especially in Park Rapids, where they actually have a big blown-up picture of a hand with all these red dots on it. And I thought, what is this? Why are these red dots? I asked them. It's outside the emergency room. They said, well, that's how many fish hooks that we have removed from hands of people visiting the area going fishing, and they average 100 a summer. Again, they want primary care physicians for a lot of those kinds of things. And, Mary, I know you've done work in rural areas. If you want to comment about how that can be more cost-effective as well.
Sure. The healthcare workforce is just essential in rural and urban areas, and parts of Minnesota, particularly some of the rural areas, have an especially difficult time attracting healthcare workforce. The Recovery Act, basically, in preparation for healthcare reform, is helping to expand the workforce by doubling the size of the National Health Service Corps. And how that works is that physicians, dentists, nurse practitioners, and others, in return for practicing in an underserved area, and again, most of our underserved areas across the United States are in rural areas, in return for practicing in those underserved areas, will be reimbursed for loans or loan repayment or receive scholarships from the federal government. So in anticipation of an increased need for primary care providers, we've started to build a baseline of investments, and the President's 2010 budget proposal continues and increased support for the production of more primary care providers. It's really important because right alongside of that, we're seeing a lot of the discussion around healthcare reform focusing on illness prevention and health promotion, and those are really at the heart of primary care, keeping people healthy, preventing them from getting sick, and pulling the investments that direction instead of investing just in the care of very serious illnesses, trying to get in front of some of those serious illnesses and prevent them through investments in primary care. So particularly important to rural areas, rural and urban both, but we've already started to see that investment beginning to ensure an adequate availability of the healthcare workforce, especially primary care providers, family practice docs, general internists, nurse practitioners, and so on.
Thank you, Mary. The next call is from Rita in Oakdale, who has a question about pre-existing conditions. Rita, go ahead.
Yes, I was wondering about major medical and catastrophic illness, if the new plan will address this issue at all, as to help people not have to choose between health and food.
Well, obviously, that is what we're trying to solve here, as it's getting harder and harder for people to afford care, and their premiums have been going up. It's a bigger and bigger slice of their family budget. Right now, the country spends $2.4 trillion on health care, and that's one out of every $6. And the issues for why they're starting to choose between that and food is that the premiums have doubled over the last 10 years, and they've grown 3 times faster than wages. So it's a larger and larger percent of the family budget. And your question here about, I know you talked earlier about pre-existing conditions and about how it's hard to get the catastrophic care and other things when you have a pre-existing condition. And we've heard about that time and time again from people who have come to our offices. Just got a note the other day from someone in Wilmer who talked about how she just had a knee problem and she had several x-rays and she had to pay for it herself because she was denied coverage because of pre-existing conditions. And one of the main focuses of this health care reform is to make sure that insurance companies can't kick people off just because they have pre-existing conditions. And that will be one of the things that we really would like to see in a bill. So when I talked about our shared value of stability, stability means not getting kicked off or have your family kicked off just because someone in your family has a pre-existing condition.
Okay, the next question is from Marie in Detroit Lakes, who has a question about the cost of health care reform. Marie, go ahead.
Yes, I'd like to know why we cannot fix these problems and implement the reforms without the billions and trillions of cost care being paid by the taxpayer.
Well, I think we have gone through today and how important it is to do this reform, that if we don't do the reform, it's going to get more and more expensive for people. So we have to remember that, is that if we just do nothing, and we just decide, okay, we're not doing anything at all, we're not going to reform the Medicare cost reimbursements that Dr. Cortese has talked about, we're not going to be able to do anything to help families with their premiums, we know the projections of what's happening because we've seen what's happening over the last 10 years. And that's why we want to make sure that we do something here. But I share your concern. We don't want to do something that is any kind of burden on middle-class families. I will not vote for something that's going to be a burden on middle-class families. The President has said that he is not going to sign a bill that will not be paid for. And that's why both Dr. Cortese and I have been focused on making some changes to this House bill to make it even more cost-efficient going forward so we can get those kinds of cost gains that we're talking about here. And I know from when I represented Hennepin County Medical Center, and people forget this, there's a hidden tax, and it's estimated nationally to be like $1,000 on every family that pays health care premiums. That hidden tax is people that don't have any health care insurance. I know this when I represent Hennepin County Medical Center as Hennepin County attorney, because people go to the doctor when they were really sick, but their doctor was the emergency room. And that is really expensive because they didn't have another doctor. So what we're trying to do here is to do this in a cost-effective way. And I cannot tell you how much I share your concern about the costs because we simply aren't going to be able to keep going like this as a country if we don't do something about our budget. That's why I support pay-as-you-go budgeting and a number of other measures to rein this in. And that's why I really do support this Medicare payment reform because we can do it better and we can do it for less money if we do it right. And that's what we're trying to do here. And I don't know, maybe Dr. Cortese, you want to add to that?
Very, very little to add. This is the heart of the issue of really true reform. Has to do with payment reform so that we're actually getting more for our money. That's the value equation. And there are ways to do that, and I think Marie is exactly right by asking that question, and we ought to hold people's feet to the fire to make sure that those providers and regions of the country that are getting better outcomes and better safety at lower costs are the ones that stay in business, and they're the ones that set the standard.
And I wanted to add one thing. I have a bill, actually, that we worked with Mayo on, and it's co-sponsored with Maria Cantwell, who's a senator from Washington, and Judd Gregg, who's a Republican senator from New Hampshire. And it's a quality bill, and it actually puts more of an emphasis on quality care for reimbursement, so we can, again, save money by focusing on quality, and it's gotten the support of doctors in our state and a number of other groups who know that if we do this cost-effective care, in the long term we're going to save money, and that's what we need to do to make health care more affordable. But I think we must do the cost reductions, or we're not going to be able to do the other piece of this.
Okay, the next question is from Ray in St. Paul, who has a question about the federal government's role in health care reform. Ray, go ahead.
Hi, Senator, and I appreciate your other guests. Recent days, the objective that was stated about bringing in health care reform, but not increasing costs, and yet the CBO, when trying to measure what the House has come up with, says it's $240 billion more a year. The President, in a more general sense, says that he wants to have the deficit by the end of his term, and yet there's a update in the 10-year projection from $7.1 trillion to $9 trillion. I'm wondering, what about the nature of bureaucracy or federal programs is it that inspires confidence in you that this can be done right versus 50 different laboratories state by state? Why does this require a federal solution? And if it does require a federal solution, why can't consumers purchase coverage from insurance companies in any state in the union? Thanks so much.
Okay, that was a lot of questions there, Ray. I want to start out with the budget responsibility issue, and I do want to remind everyone, I think people know this from the costs of the wars and other things, that the President and our Congress did inherit an enormous record deficit that we just hadn't seen, and it changed from a surplus from the early 90s to really a record deficit. So when the President came into power, that's what he inherited. And so what we've worked to do is to cut the deficit in half by 2012, by two-thirds by 2014. And that's the goal, and that's what the plan is and what we've put into place. Where do I see the money being saved from? It's from the very ideas that we're talking about on this call. Just think about that, $50 billion in taxpayer money every 4 years if we just put in place those kinds of reforms that Dr. Cortese has talked about in the Mayo Clinic. You put in other pay-as-you-go budgeting. I support with Social Security, putting it in a commission that is appointed by both Democrat and Republicans that looks to the long term of how we can make smart decisions so Social Security is solvent, and then go for an up-and-down vote in the United States Senate. Those are the kinds of things we can do to get our budget back on track. As for some of the other questions that you asked about insurance and looking at state by state, I think we can look at these things, but we want to make sure that the consumer regulations are in place on the federal level so that we can increase competition, but at the same time increasing the consumer protection. I don't know if any of my other two guests want to add to that answer.
This is Mary. I would just make an additional comment about an investment in prevention, and that there are places like prevention, illness prevention, and promoting health where we can also achieve savings if we realign the incentives. So, for example, just to give you one example of a pretty common condition, healthcare problem, diabetes. Every dollar that's spent on a diabetic pregnant woman in terms of preventive care saves complications of over $5 worth of complications in those mothers and babies. So it's just common sense. If we realign our investments, instead of waiting until people get sick and have associated health care costs, and instead add into a focus in healthcare reform on prevention, then paying for prevention like routine checkups and so on can actually be ultimately a cost savings for us. Using that just a very direct and simple example, I'd mentioned mammograms earlier as well. So some of the conversation in terms of cost savings is even around trying to prevent the exorbitant amounts of money that we're paying now because we're making our investments on the back end when people become sick as opposed to on the front end in terms of preventing a serious illness.
And Senator, if I can comment too, I think that's a really great question Ray had. The idea of having various options being used throughout the country that we can learn from, and indeed the public plan that is available, that Federal Employees Health Benefit Plan, is a series of 157 private insurance companies that are, most of them are non-for-profit companies, or at least capped in their products, and they're available throughout the country. So giving them a chance to try all these various types of options with the purpose of getting better value will also provide us an opportunity to look at investments in prevention that Mary was just talking about, because you have to spend some money to get that long-term return. And that longer-term return is really true value from the patient's perspective. It may avoid them having some problems down the road. So that's what we mean by payment reform, looking at value in the long term.
That was very well put. And I'd also add, we do have, when I talk to our veterans, they have reasons to complain and moan here and there, good reasons about the VA system. But if you really push them on it and say, well, so should we get rid of that? They say no. They like the system that they have. And so there are examples where government may not be perfect, but it has been able to at least push with the power of numbers, whether it's our veterans or whether it's what we're trying to talk about to get a number of private plans where they engage them and negotiate with them to get cheaper prices. I mean, that is what I'd like to see with prescription drugs, and I would love that to be part of it, where we would be negotiating, the government negotiating under Medicare Part D to get less expensive prices for our prescription drugs. And I have voted for that, and I will vote for it again, because there are ways where the government can at least push to get cheaper prices, and we need to use that power of the power of the people, basically, to say together we don't want to have these higher prices anymore, and we want to push and negotiate just like big companies do. So that's the idea there. I will note that we're over an hour on this call, but we are going to take 15 more minutes. We were late in starting, and so we want to do that. We found out we have over 10,000 people on the call, so we will keep plugging through the questions, and obviously we'll have a voicemail option at the end if we don't quite get to your question. So, Zach, do you want to continue on with the next question?
Sure. Thank you, Senator. The next question is from Peter in Maple Grove, who has a question about privacy as it relates to health care reform. Peter, go ahead.
Yes, thank you. Some of the information I'm reading indicates that part of President Obama's plan would allow for the government to have direct access to people's bank accounts. And I'm just wondering what the senator feels about that and what your thoughts are on that.
Okay, well, I think, and again, I'm focused on our Senate plan, which we are still working on. That's why we're doing this call, to get all of your ideas, and that is still in formation, which I've said before is a virtue, because we can take back your ideas and put them into action. But I think what you may be referring to is a provision in the House bill, and I just want to make that clear to the people on this call that that provision doesn't allow access to bank accounts. It does allow doctors to have access to make sure that patients are covered by insurance, and that may be what you're referring to. The other piece of this is that we have very strict privacy protections, the most sweeping privacy protections in the history of the country, that went into effect with the recovery bill, that stimulus bill, because we had in there funding, the initial funding to start that medical technology going, so you don't have to carry your x-rays like I did all over with my bad hip and carry those x-rays with me. Instead, you'd be able to have them once on one piece of machinery, and then it can be transmitted if you give permission to have it transmitted. So what we did with that is we put some a very broad privacy protections in for patients, because we all understand how important that is. So thanks for that good question.
Okay, the next question is from Larry in St. Louis Park, who has a question about small business healthcare reform as it affects small businesses. Larry, go ahead.
Hi, I am a 46-year-old male who works for a small business that is only willing to pay $100 towards health insurance in their plan. With their plan, I would have to spend over twice as much as they're paying to get covered, and right now I'd have to choose in between health insurance and bankruptcy, or no health insurance and a good credit score. And I was wondering if there's anything in this plan that would allow people in small businesses to choose their own insurance and use what the small business is willing to pay.
That's a great question, and I have to tell you, I've been up talking to small business. I just came from southern Minnesota. I was there for 2-3 days, and now about a month ago I was up in northern Minnesota, up at a company called Granite Gear in Two Harbors. And the owner of that company started it, I think it was like 10-15 years ago. He's now paying $24,000 for his family of 4, a small business owner that employs many people up in that little town. And he said if he had been faced with that from the beginning when he started the company, he didn't have kids and he wasn't that worried about health insurance, and if he'd known that at the beginning, he probably wouldn't have started that very successful little backpack company, which is now producing backpacks for our troops. And for me, that story really hit home, because I realized we're not only going to, it's not only unfair to our small businesses and employees, it's going to stifle innovation. It's going to stifle people from starting small businesses, which really been the backbone of so much of our economy in America. And so that's why I like this idea of making it easier for small businesses. Now, I'm going to let the other guests here talk about this as well, but one idea, of course, is to allow small businesses to buy into something like the federal health care plan. You can call it whatever option you want, but it's a series of private plans, and the federal government's able to negotiate cheaper prices so that you can buy into that same kind of health care. There's 8 million people on it right now. I'm the co-sponsor of the SHOP Act with Senator Durbin of Illinois, which, again, is focused on small businesses, and that's what we keep pushing when we have meetings on health care. Let's look at, in this bill, to make this one of our big priorities, is to make it easier for small businesses and self-employed people to buy in. As I mentioned at the beginning of the call, 20% more for them to buy insurance than it is for big businesses. I don't know if Dr. Cortese or Dr. Wakefield, and by the way, Mary Wakefield also has a doctorate in nursing, and so that's why we sometimes are calling her doctor and sometimes calling her nurse. But I don't know if either of you want to add to that for the idea of helping small businesses.
Well, thanks, Senator. I'll make one comment. It was made earlier, but I think it actually applies to this very question. We have seen, based on surveys, that about 3/4 of small businesses surveyed across the United States do not offer benefits. They say their primary reason for not offering benefits, the high premiums. So premiums are high in part because of what we discussed earlier. That is that hidden premium tax or hidden insurance tax, where individuals, families, and businesses, and it hits small businesses certainly hard, that we have to contend with that hidden premium tax for the unpaid costs of care that's provided to the uninsured. So it's worth reiterating that if you can take that off the table, that will take pressure off of small business.
Senator, I'd like to comment too, and this gets back to our point that I made at the very beginning about what true insurance reform is. We feel that insurance, just like everything in medicine, should be centered around the individual or around the patient. We don't think the employer, large employer or small employer, has to or should be required to provide that insurance for individuals. We think everybody should have the option or the ability to have their own insurance that they can buy, whether they're large employed or small employed individuals, whatever category you want to place them in, and a model like the Federal Employees Health Care Plan where people can buy from around the country from a set of choices that are available to them with the government helping to support those who cannot afford to buy it themselves. We've spent a lot of time talking about this, and we think this is the best way to go. If an individual employer, however, wants to contribute to the purchase for that individual or buy it for that individual, that would be up to the employer to do, but the individual is the person who should own that insurance and take it with them. So it doesn't have to be employer-based at all. We're strongly in favor of true insurance reform being focused on the individual, and they should be able to buy it, have help purchasing it, but they own it and they can take it with them.
Thank you, Doctor. We have time for just a couple more questions. The next one is from Laura in Ham Lake, who had a question about portability of insurance and the expansion of health savings accounts. Laura, if you're on the line, go ahead.
All right. Hi. Thank you. I wanted to ask the Senator if she would consider supporting reforms that would equalize the tax treatment of the insurance. I understand right now if you get your insurance through your employer, that's not taxed or you don't get any extra treatment there, but if individuals are buying it, they don't get any tax break. And also, would you support expanding health savings accounts to everyone?
First of all, we do want to make it easier for individuals to buy insurance, and I'm very concerned if any of the proposals would make it more difficult and more expensive based on the tax system for individuals to get insurance. So, I'm open to any proposal that's going to make it easier for the middle class here. The second question about HSAs, I do think we can look into those. Obviously, we know they're not the only solution, but they do promote patient choice. I will say that just this idea of more personal responsibility is going to be very important in this healthcare debate. That's why we want to have incentives for wellness, why we want to have more responsibility for our doctors and our healthcare system to give quality care, and that's really underlying a lot of what we're trying to do here when we look at the cost savings.
Okay, and I think we have time for just one last question, and we're going to go to Steve in Mendota Heights, who had a question about healthcare reform generally. Steve, go ahead.
Good evening, Senator. My question is... Yes, good evening. My question is this, Senator. As you speak with senators across the aisle from you, how close or how far apart are you with reforming health care? Are there ideas coming from both sides of the aisles, and do you think that we can get a bipartisan agreement on this bill?
Well, Steve, I think, first of all, thank you for asking that question, because people have seen a lot of screaming and a lot of yelling, and I actually understand why people are concerned about this. Health care is a personal matter for people. They want to be able to keep their choices. They want to make sure their mom has the right health care, just like I do, and they want to make sure their kids are okay. So I understand why it's emotional, and I actually think there's some real advantages for us to have a strong debate on this as we go forward, because as we've learned on this call today, it's really complicated and people can have some differences of opinion. But what I see are these common values that we have here, that we want to have a uniquely American solution. We know it's 17% of our economy. We know we're not going to make it just like some other country, but if we follow through on these values of making things more stable, of making it more affordable, and of trying to keep what we've got that's good, which is especially we see in Minnesota all the time, I do think we can get some kind of a solution. We're not going to get every single person on this we're not going to be able to get every single person on this on the bill. I can tell you that right now. We never do in Washington. There's always people who have a difference of opinion, but I do think that we can get some Republican support on this bill. As I mentioned, I talked to Olympia Snow just last week. She's still hanging in there, and I think we're going to be able to do it. And there are a lot of people that are Republicans who own small businesses, who know what we're talking about here as we talk about, as Mary Wakefield and Dr. Cortese and I talk about reducing costs and making things more efficient and still having the high-quality care that we want. This is really about having a more accountable, responsible system, and that's why I think in the end, this isn't like when we talked about this years and years ago. Right now we've got small businesses struggling to make ends meet. We've got big businesses having trouble competing internationally. We have families that are seeing their premiums go up double since 2000 and doubling again in the next 10 years. So people have a real stake in this. It's not going to be easy, but it's something where we have to find these solutions. And it may not be some of the bills and some of the provisions that people are worried about right now, but I think that in the end, whatever we do has to be meaningful, and it has to reduce costs, has to make it more affordable, and it has to make it higher quality care for the people of this country. Otherwise, we shouldn't do it. And Dr. Cortese, Mary, I don't know if you want to add a few things here at the end. Mary Wakefield, Dr. Cortese.
Oh, I think you wrapped it up.
Agree with Senator, and I think we will be able to get something over time. I have faith that our really good leaders are working hard on this, and I hope we'll see something come out that at least will allow us to move forward and reduce the costs. And I'm speaking from the provider standpoint at this point.
And I would just say that clearly we're seeing more Americans being denied affordable health care coverage for the reasons that you've cited earlier, Senator, pre-existing conditions and other problems. We've got more folks who are facing soaring copays and deductibles that are taking bigger bites out of family budgets, even as their insurance coverage in some cases begins to cover less. And we have more businesses that can't meet the cost of health premiums, even though we've got lots of business folks who absolutely want to keep their employees covered with health insurance. They struggle mightily in order to do that. Those problems are not staying the same. They're not getting better. Each year, these problems are destined to get worse if there isn't some action taken, and it will be significant action that will be required to address affordability and access to high-quality care, like you have in Minnesota in terms of some good, solid, high-quality care. Thanks for the opportunity to be with you tonight.
Well, thank you, and I just wanted to thank everyone for participating. I want to just remember one story that I heard when I was just down in La Crescent just a few months ago, and it was from some of the doctors who are with Gunderson Lutheran that also have hospitals in Wisconsin. And they told me the story about how within a 1-month period they had 3 patients who were in their emergency rooms, and they all had ruptured stomach problems or appendix problems, and they had all gotten to the point where they should have come in earlier. And they said they talked to those patients. One of them was concerned about the payments and didn't have good health insurance and just avoided going in and waited till that point. 2 of them were at small businesses and were worried about the effect it would have on the small businesses in terms of their own bottom line in affording health insurance. So this is something that's going on now, and I truly believe in a Minnesota way we're going to get something done here. I was with former Senator Dernberger today for his 75th birthday. He's committed to this at age 75. And we just have to listen, and we have to work together, and we have to look at what we can do that's smart. And I know that the country is watching Minnesota, and that's why I want to make sure that any solution that we come up with is good for our state, and it promotes the kind of efficient, high-quality care that we have. So I want to thank Dr. Cortese and Dr. Wakefield for being on this call. And want to make sure that you know that if you weren't able to get your question answered, you can leave a message in the voicemail with your phone number and maybe your email so that a member of our staff can follow up with you. You can also visit our website, klobuchar.senate.gov, for information about upcoming public events. It's going to have the days and times. I'll be at the State Fair, so you can come and see me. We are nicely located next to the Snake Zoo and across the street from the Pork Chop on a Stick and Haunted House at the corner of Judson and Underwood, so hopefully you can come by and see me then, as well as the other public events we're doing across the state. So I want to thank you again for taking the time on a beautiful Sunday evening in Minnesota to be with us. And I'm going to take back with me to Washington your ideas, your concerns, your thoughts, your questions, so we can continue to work together on an American solution to this important issue. Thank you.